We're following up with Governor Gavin Newsom right now as the state is short on funds for its Medicaid program, also known as Medi-Cal. And this all comes after the state expanded the program to provide undocumented people with health care.
Well, now Governor Newsom says the state needs billions of dollars in loans. KCRA 3 Capitol correspondent Ashley Zavala caught up with him at the state capitol today and is here with what he had to say.
Curtis, this week the governor asked lawmakers to approve another $2.8 billion loan on top of the loan he got last week for $3.4 billion. So California is now making up a $6.2 billion shortfall for its Medi-Cal funds. This money is meant to keep the state's Medi-Cal program funded through June. State lawmakers recently expanded this program that provides health care to low-income people to all Californians, regardless of immigration status. But Governor Newsom's administration and Democratic state lawmakers underestimated just how much that program would cost. This year alone, they estimated it would cost $6 billion. But at last check, the cost is now estimated to be $9.5 billion by July. That's just an estimate. The federal government financially helps with Medi-Cal programs, but obviously the state does not expect the Trump administration to help with the health care for undocumented people. But the governor refuses to solely blame the expensive costs to the state of providing it. I asked him about this today.
Is there anything you can share about just the undocumented healthcare expansion and how that's contributing to what's happening right now?
That's partial. You've seen in Pennsylvania, Colorado, Indiana that don't have that expansion. They had even more sizable supplementals into their Medicaid system. This was something we previewed in the January budget, something that I previewed in separate conversations with other governors. It was highlighted actually in December at the Democratic Governors Association as an issue we were seeing all across the country. So all of that is exactly as we advertised in January, and we're working through that. The good news, you've seen the revenues in the state that we're collecting are above projections. The economy continues to be remarkably resilient.
Is this the last of the loan requests from your administration for the year, do you think?
Yeah, and you've seen this in the past. We've done these letters, the legislature, we've done these supplementals in the past. As I said, I noted 4 states that I'm just more familiar with.
No chance of rolling back any of the immigrant health care?
Well, it's not on my docket, okay. but that said, everything's, the realities are the realities. You have to balance budgets. We balance our budget. Revenue is holding up. I don't see anything significant along the lines of what some have asserted. But I do see the need to make adjustments and changes broadly in the Medicaid system.
Again, the governor there noting that he's likely not going to roll back that program that provides health care to undocumented people here in California. But meanwhile, Republicans are blaming Democrats for creating financial insecurity with the state's important health care program. Assemblyman Carl DeMaio told reporters today state leaders need to immediately rescind the health care for undocumented people because he says the state simply cannot afford it. Back to you.
All right, Ashley, thank you.